for people who have just joined, a very warm welcome to the second of our Connectors workshops. I'm Tasha or Tash from Ewoza. Some people might also know me as Anastasia. So I've got a couple of names. Anastasia is full and formal, but for this session, it'll be Tasha. So I thought as we start off, as you can see on the slide, please, as you join, introduce yourselves and tell us how your day's been today in one word. And I'm just gonna sort of run through the projects. I just want to check that my slides can actually turn. Oh, great. Yeah, so I just wanted to introduce everyone and sort of set the tone for the program. Also just to acknowledge and introduce our collaborators who have helped and been instrumental in organizing the workshop. So this has been a joint effort between MESH, led by Helen Latcham, and INSAFA, led by both of whom are on the call. So if you have any specific questions about connectors or the workshops and the workshop series, please direct them to them also in the chat. So before starting, I thought I'd just talk a little bit about what we mean by connectors and sort of set the tone for the workshop, because the whole point of this is to bring people together and discuss the role that connectors have in public and community engagement. So what do we mean by connectors? These are individuals, agencies, creatives, and other organizations outside of research or science in a traditional way. Connectors play key roles in bridging the gap between research and communities. And this can be a range of people, so engagement experts, local charities, creative agencies, artists, other people in the creative industry, private businesses, or community and patient groups. So the kind of type of person that a connector is very broad, but plays a really important role in bridging the gap between research and communities. So this is sort of the focus of our whole series. I thought I'd run through the schedule of workshop 2 for today. So we'll have a short networking session after this. And then our first main session is really focused on who sets the agenda, and we'll be having a case study on that. And then some tips for planning a new project. And we have a group of really great speakers for that. At 12:10, we'll have a break. And that just gives us a bio break and a time to make some coffee. And then in session 2, we'll be looking at how we address challenges in multi-partner projects. And we'll have a really great set of speakers for that. We also have a breakout session that will be facilitated and really aims to be a safe space for sharing challenges and also looking at solutions to some of the challenges that we've had. Then we'll be having a plenary discussion, and the last bit of the day would be a reflection on the key themes that have come out of the workshop. So again, a very big welcome to everyone for joining, and a big thank you to Helen and Nabil as well. And yeah, I hope everyone has a great workshop. The next thing I just wanted to highlight is where people can find resources, and if anyone wants to either look at social media or do some tweeting during the workshop, these are our social media handles, and also the workshop 1 materials are now available on MESH. So if anyone wants to familiarize themselves or contextualize, and then also to point out the materials that come out of this workshop, workshop 2, will also be available on MESH shortly after the workshop. And also please sign up to MESH, because there's a lot of great resources there for public and community engagements, and all of the links are there. We can also, Helen's also put them in the chat in case it's easier to access like that. Hi everyone, welcome back from the breakout rooms. We decided that because we have quite a bit of time, we would start session 1 early. I don't know if anyone has any questions or comments from the breakout rooms. We have a little bit of time, otherwise we can go straight into session 1. So if you do have any questions or comments, please raise your hand, and I'm just going to check that there aren't any. Otherwise, we'll start session 1 5 minutes early, and it gives me great pleasure to introduce Zandile. I first met Zandi way back, I think in 2017 or 2018, when she took up the position of public engagements manager at CIDRI Africa. So she was CIDRI Africa's first public engagements manager, and CIDRI Africa itself was a new Wellcome Research Center. And so I think Sandy joined a very challenging environment for an organization that was trying to establish both its full identity, but also its identity as a leader in public engagements in the local context. And so Zandile is a highly experienced public engagements practitioner. She's also really, really warm and friendly. So she's a great person to have in the office. It always makes you feel good about the work that you're doing. And I think we're really lucky to have her here facilitating the next session. So for now, I'll hand over to Zandile.
Wow. Thank you very, very much. You made me feel like I have to look in the mirror and think, is that me? Yeah, that's me. Thank you so much, Tash. Thank you so much. I'm so excited to be here. I'm seeing so many familiar faces. Hi, Alun. Hi, Caroline.
Hi.
Oh, this face is really just bringing so many memories.
Just
like, yeah, I'm telling you, just interaction that I've had with other specialists around community engagement and how they really actually held my hand throughout everything, because I think I was the newbie starting out in 2017. So thank you so much, guys. Truly appreciate it. So yeah, so good morning, good afternoon, and good evening to everyone. So I will be facilitating this first session, and really we're just going to be looking in terms of when you are setting out your project, who is really having that hold on the particular agenda of that project. So looking at power dynamics, who's holding the most power, relationship, how do you maintain and build those relationships and also keep momentum, and really also having the motivations behind that. So how are you able to right till the end, make sure that the set of outcomes that you've placed are really speaking towards each and every single collaborator. So really having a common set of outcomes, and how are you able to manage that. And the first session will really be looking at managing different approaches and ambitions and motivating and motivations. And we are going to be looking at Caroline. Caroline Ngara is from the Institute of Anthropology, Gender and African Studies from the University of Nairobi. And we also have project coordinator at the Reproductive Health Network from Kenya, Joy Mboya. And they will actually be talking about their project around talking trees, and we're really looking forward to hearing from them, really absorbing and learning and really getting that input that we want to get in terms of managing collaborations and managing collaborators in a particular project. So over to you, Joy and Caroline.
Hi everyone, my name is Caroline, as you've been told. My colleague is Joy. Can you put your video on?
It's on.
Yeah, so we are going to deliberate on the Talking Trees project. We got funding from the Wellcome Trust in the year 2016, consecutively up to 2019. And the project has come to a conclusion. It actually concluded in 2019, but we're still carrying on with the publications. And today we are going to share with you about the project. Is it visible, the screen sharing?
Yes,
yeah?
go ahead.
Yeah, so in 2016, we got funding from the Wellcome Trust for the total Talking Trees project. It was a public health research and forum addressing maternal deaths and maternal health care prevalent among the pastoralist communities of Kenya. The project was launched in Kajiado and Narok counties, and afterwards in Wajir and Garissa counties. So the project was introduced in several participatory phases. First in Kajiado County, I know you don't know the places, but I'll just try to name them. We first did it at Kule, Namanga, Ngong, Kiserian, Jerusalem, Olkeri, Oljororok, Ntalel, Naijile Oltinga, and Dandapo. So in Narok, we did it at Sere Olimpi. Lauragi, there was Lauragi 1, but we did it at Lauragi 2. We did it at Lengade, Leshunyai, Lenchekut, Lorian, and Sontia 2. So during the implementation of the project, numerous changes took place. While knowledge of human rights improved, maternal health care, education, personal health responsibilities, attitudinal and behavioral change also against FGM increased. The organization of the self-declaration on public declaration on abandonment of FGM also evolved significantly. So the project was introduced in the following modules. We did it on maternal health care, FGM, which stands for female genital mutilation and cutting, alternative rites of passage, female health, sexuality, pregnancy, management, and childbirth. We also covered HIV/AIDS and mortality, human rights, child development, and early child marriages. So for the total project, we had collaborators, and we also have project implementation partners who are the Kajiado County, Narok County, Ministry of Health, National Anti-FGM Board, NOSIM Radio, Nomad Radio, Girl Generation in the UK, Wajir County, Garissa County, Girl Kind Foundation, and Reproductive Health Network, Kenya. The total objectives of the project was, initially we thought we wanted to engage the pastoralist communities through participatory health research forums and debates designed to enlighten and change their attitude towards FGM, female genital mutilation and cutting. But the project also brought together a multidisciplinary team of experts who are anthropologists, scientists, healthcare professionals, public healthcare officials, and also doctors and gynecologists. The project also brought together pastoralists to discuss and develop an understanding of the discrepancies between modern science and outdated traditional practices that would help the researchers to understand the main causes and ways through which they could curtail the maternal deaths that were prevalent among the pastoralist communities. So it also helped us to identify challenges and support gaps in research dissemination to the general public, so as to develop appropriate information materials in indigenous languages, mainly the Ma language for the Maasai community and the Somali language for the Somali community, that would contribute to the community outreach work, because not all the pastoralist communities to identify challenges and support gaps in research dissemination to the general public. Joy?
Next slide.
Um,
Okay, thank you, Carol. On the project outcomes of the Talking Trees, quite a number of outcomes were realized, like increased and accelerated public declarations on the abandonment of FGM. We had awareness was raised on the dangers of the FGM because it was really highlighted. And we had a number of decreased rate of girls wanting to be cut. The girls were now aware that they could pass the right, the rite of passage could be done through other ways, not necessarily through the cut. Then we also realized that there was awakened interest of pastoralists, communities, and intensified their participation in their own community. The communities also became aware. Sorry, okay. I guess you lost me on it strengthened the project collaborations between project team, researchers, gynecologists, and the pastoralist communities. We created stronger collaborative capacity in quality, public engagement in terms of FGM work locally, regionally, and globally. The project also helped organizations and health workers develop strategies for galvanizing positive social change in order to influence policies.
You can't hear. Hello?
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 Yes, I can hear you.
Okay, thank you. So it created stronger.
Hello?
Hello? Can you hear me?
We can hear you, Jawed.
Okay, thank you. It created stronger collaborative capacity in quality, public, It helps the organizations and the health workers to develop the strategies for galvanizing the positive change in order to influence policies that support the development of promotion of alternative rites of passage. This is through the scientific research. Then we'll go to the next slide, the challenges encountered. Yeah. So you realize the project was not a smooth sailing, so much through the implementation stage, though it was not implemented without challenges. The project encountered massive backlash due to the cultural sensitivity and owing partly to what was deemed as insensitive project approaches. So to mitigate this, the project adopted the do no harm ethical principle. And this really helped the team to avoid reinforcing support for the practice of FGM. We had also the cultural insensitivity, evoking backlash and denial, which could set back efforts to end the FGM. We had also undermining local efforts and leadership to end the FGM by reinventing the wheel rather than building on existing work. We had also fragmenting efforts or causing divisions among actors working to end the FGM. We had rigid donor-led approaches, which may have been out of sync with the local realities. We also had putting activists, the FGM survivors, the young people, and other potentially vulnerable people at risk. Stigmatizing or causing emotional distress to those who have undergone FGM was also a challenge, because you realize those who went through were feeling like they were, they went through, inhumane practice, while the other group that now are, being taught to the other rites of passage, there was that stigmatization. Then we also had replaced.
Hi, Joy.
Hello?
Just to disturb you, could you please resume the slideshow, please, for us? We just want to divide it so that we are able to read as you go along.
Okay, just a moment. Mm-hmm.
Thank you very much.
Yeah. Okay, so I was on my second last point, the stigmatization or the emotional distress that were caused on the people who had been, those who had undergone the FGM. That's what I was explaining. Then also the replacing the most severe forms of FGM with so-called minor forms was also a challenge. So I'll let Caroline tackle the interdisciplinary part.
So to implement this project, we teamed up with the
Yeah.
Just unmute yourself, please.
Okay. So we teamed up with the interdisciplinary teams for the project. So to accomplish this successfully, we kind of encouraged clear interdependence and collaboration among the team and the implementing partners, because every partner came up with their own agenda, expectations, and the missions that they wanted to achieve. But we made sure that everybody was working under the same umbrella to achieve common goal. We also had open communication and shared decision making. We set definable project participation and also group consciousness. We shared vision and sense of purpose and coordinated actions. For example, we had like one of the project partners, the National Anti-FGM Board, played a policing oversight role, because for them, they came to arrest anyone who was practicing FGM. And for us, we told them, for us to be able to implement this successfully, we have to adapt the do no harm approach in order not to scare the indigenous communities away, because most of them were now doing the FGM practice under covers, so that not to get arrested by the National Anti-FGM Board. Hello? Can you? The need for the interdisciplinary teamwork was necessitated by different factors. But the main reason why we started the project, we were feeling that the increasing need for increasing indigenous population brought about more complex healthcare needs associated with FGM-related issues, and the increasing complexity of skills and knowledge required to provide comprehensive care to FGMC, because we felt that no one person had the capacity or the professional knowledge to handle the entire FGM cases and complications. What the healthcare professionals were dealing with on the ground was totally different with what nurses and gynecologists were dealing with at the medical level. So we felt like we had to come up together as a team so as to address the pending issues. Also, there was an increasing specialization within healthcare professionals and a corresponding fragmentation of disciplinary knowledge, resulting in no one healthcare professional being able to meet all the complex needs brought about by FGM. There was also the need for the current emphasis in many countries, especially the UK, because we have a Somali diaspora in the UK, and also a few number of Maasai people are also traveling to the UK and the US to try and start families there. So the larger population in the UK and larger some parts of Europe like Sweden and Germany are the ones who necessitated the issue of bringing about policy for FGMC. So our project was funded by the Wellcome Trust as a result of Girl Generation UK fronting the issue of public awareness on the dangers of female genital mutilation on maternal health care and the rights of women. So that is all we had for today, and thank you for your time.
Thank you very, very much. Thank you very much. We are truly inspired by the work that you've done, extremely insightful. I do see there are a few questions. I'm going to see if I can maybe take one or two of those questions. And please do note that if we don't have any more time in terms of expanding on the questions that you have, please do put them on the chat. We will then have a small session right at the end where you can then engage directly to the presenters, and they will then be able to respond directly to you. So I just want to see, there was a question around Bono Sen. Can you expand on what the donor-led approaches were and how these were out of sync with local realities?
Yeah, I've seen the question sent by Bono Sen.
Yes.
The donor-led approaches were, for example, we had a collaborative donor between the Wellcome Trust and the Girl Generation UK. The Girl Generation UK wanted FGM to stop immediately, and for the pastoralist communities to abandon that practice with immediate effect. Not forgetting that this is their culture, that they have practiced for centuries. We were just outside as agitators, as they called us, coming in to tell them to stop their cultural practice, which is out of sync with the current century. So the Wellcome Trust gave us the autonomy to actually handle the case and to do the project and the research with the participation of the indigenous communities. That's why I said that the donor-led approaches were out of sync with the realities on the ground. And that is why we came up with the do no harm approaches, because if you look at the do no harm approaches that we had, I've connected a link there. If you click that link, it will lead you to an online paper that we wrote. If you click later on at your own timing, it is a 99-page document that elaborates the do no harm practices that we felt that if all of us as a collaborative team work together, we will avoid reinforcing the support for the practice of FGM. Instead of telling them to stop that practice immediately, or they start doing it underground where nobody's seeing, we wanted to be culturally sensitive and stop evoking backlash and denial, because we have people who have been cut, we have people who are still cutting, and we have people who are cut and they're still hurting. So how do we not condemn these people as a backward community, or people who are not interested in civilization? So we put ourselves into their shoes and tried to kind of think, what would we do if it was us? Yeah, and the Welcome Trust enabled us to achieve that. Yeah, so we kind of did not undermine the local efforts led by other activists. We did not fragment the efforts, causing division among the actors, and we did not also put the donors under the radar, because they gave us the funding to stop this. But how do we stop it? Not immediately, but gradually. So between 2016 and 2019, we have managed to help the pastoralist communities to organize their own do no harm declarations of stopping the FGM. I hope I've answered that well.
Thank you, Caroline. And I see also Richard has also given us some insight in terms of the do no harm tool around the concept and how it was developed and when it was developed. So thank you, Richard, for that. And Bono says, thank you, Caroline. Thank you very much for that. Really, really insightful work. And thank you very much, Caroline, for explaining some of the concerns and the questions that the participants and myself as well, coming from South Africa, where I know that we also practice circumcision for our young South African men. And how do you navigate that and make sure that it is, cultural sensitive, but also you look in terms of the health implications for those young men, and making sure that, you navigate those two realities, because they are realities at the end of the day, and making sure that you have the desired outcome, which is to make sure that the young girls in your particular case, really are being looked after, and they're not being caused any harm with this particular practice. So thank you, Caroline, and thank you, Joy. I really look forward to really interacting with you guys later on, and really hearing more in terms of what the participants have to ask, and whatever concerns they have around this particular project. Thank you very much.
Thank you.
Thank you.
Welcome.
Thank you, too.
All right. So we actually want to ask you now, moving forward, in terms of what you have heard from Caroline and what you've heard from Joy, in terms of what would you be the top tip that you would give to your collaborators, in terms of how do you plan a multi-partner interdisciplinary project? So how do you go about doing that? Just put into the chat your top tip in terms of planning for a multi-partner interdisciplinary project. I think I'll start with me. I think really the open communication resonated with me when Caroline and Joy were speaking about it, and also just speaking in terms of transparency, understanding what the limitations are for each partner, and really making sure that there are no sort of unworded expectations when you are planning a project that has a lot of different partners and collaborators. Working within community engagement, I found myself that I work with partners that I had never imagined that I work with. So, for instance, it was as people that are more into sort of a reporting style, sort of a media, coming up with different communication modes to bring awareness around TB, HIV, and that was completely different from my experience in terms of more face-to-face and more direct interaction and consultation. So I think it was fantastic for me to get to a point where I understood where when you are planning these projects and you have different partners, to have that open communication and making sure that in terms of the roles, you understand, who does what, how, and also the limitations in terms of what is possible for a particular collaborator, so that there is really a clear communication at the end. So I see Nabil has put in, wow, right. Right. Thank you so much, Nabil. I really, really love that. Also speaking about communication and really just making sure that you are understanding the local sensitivities. I see we have D. Kumaya Dorcas, who's also speaking about building the right team from the inception of a project. We've got Michael Finn Mbewe talking about the strategic research and communication. It's important to deliberately make it a back and forth process. Definitely. And I think it also is very important to speak about the ownership for that particular project, because I think that it brings in that power dynamic in terms of who owns this project. This project then needs to be owned solely by the partners that are part of the project, or is this project actually going to be transferred into the broader community? Who's going to be able to use the outcomes of this particular project? Who are we doing this project for? So all those questions really coming out in terms of what is your top tip for planning a multi-partner interdisciplinary project. All right, please do send through those top tips. Please do send those top tips. I see Sarah is saying spend enough time to ensure all partners are on the same page, share vision and underlying principles. Definitely, really definitely. As I said in the beginning, we've got different ways of really reaching the same goal. So we just need to always make sure that within that particular journey, everybody's understanding of that. Stacey saying friendship. Oh, yes, Stacey. As I alluded in the beginning, I am missing the friendships that I have built through working with different partners, even though it was not specifically for projects, but really sharing best practices. I'm missing those partnerships that we've developed, really just becoming collaborators and making sure that the framework that we build for community engagement stems from stems from a friendship. All right. All right, thank you, everyone. So I'm going to actually move on, and I'm going to ask our two speakers to really talk about their experience with working with multiple partners on health engagement projects. Our first speaker is going to be Nabil Peterson, so the director of Interfer and co-founder of Pivot Collection from South Africa. He also happens to be my city mate, both from Cape Town, and Kim Dali Wadilov, who is the communications officer at Sub-Saharan African Network of TB and HIV Research Excellence, Sante, in South Africa. So I'm going to hand it over to you, Nabil and Kim, and we're really looking forward to hearing you guys in terms of the top tips that you have for us in planning of a new project. Thank you.
Hi, Zandile. Hi, everyone. Can everyone hear me? Just not particularly sure if my screen is showing right now.
It's definitely showing. We can see you, Nabil.
Excellent. Thank you so much. It's really great to be here again. And I have to say that it's really hard to come up with 3 tips when looking at planning a new project. We've worked on so many projects, and with the 2 roles that I currently hold, we considered outliers. Ewoza is pretty much the same. So with the Pivot Collective, we are an NGO based in South Africa, but with representation globally. And we primarily involved with egalitarian collaboration. So we like working in a way that the table, when it comes to power, is open and everyone has a voice with that table. We're active in collaborative knowledge production and translation. And then also we're quite passionate about mental health. With Interfer, which is a small local company, we focus on participatory research, participatory storytelling, and the participatory arts as a means of data visualization. So just in saying that many things, it becomes really hard when I start to think about the 3 top tips or isolating those tips. So my tip number 1 is whenever Pivot or Interfer has worked with projects with different populations, whether it be beneficiaries of projects, we don't quite like those terms, or with our other partners, we always work to establish a shared value system and principles that would guide the project and overall interaction within that project. So imagine that this shared values and principles is the actual operational culture that acts as our North Star, so sort of our guiding principles. And we always tend to work with this at the very beginning of collaboration so that everyone comes to the exact same table. We design projects together to ensure that we have multiple vantage points at the very beginning of the project, meaning that we don't speak on behalf of others and we don't come with a predetermined project. Rather, we have an idea and we allow that idea to be flexible in working with others. This culture also avoids us from tick boxing and looking at projects as a very sort of strict tick boxing approach to evaluate success or failure. It also ensures that the project remains meaningful beyond the lifespan of the project and that communication is not unidirectional. So we like to open up pathways for inclusive research, participatory development, whatever that means within the specific space attended by different people. Also, it's quite reminiscent of traditional approaches to development. We avoid this. The idea that we are coming into your space and assisting you, we sort of deleted that in the 80s, right? So we very much want to be working with people because of this rejection of traditional developmental thought. So ultimately, coming up with these shared values and principles would establish a collaboration that drives the project through to completion and beyond, because it allows us to establish meaningful relationships within a given space beyond the project cycle. So what this means is, and if I would try and cough up an example, we're working with young people in the area of mental health research, and we've been speaking to Richard Kilpert quite a lot, who you'll hear from later. And it means that the young people guides what research is within this process, how research is published, and how the budget is ultimately spent. So that would be my tip number 1, establish your shared values within the space. Number 2, it seems rather obvious, but we tend to invest a lot of time in rapport building, relationship building, and looking at active learning between and across stakeholders. This just means that we strive for egalitarianism. So we strive for a removal of the idea that someone has power over someone else, whether it is the budgets of our projects, how we devise projects, how we evaluate projects. We tend to try and minimize that power imbalance, acknowledging that it still does exist. We also value that in building these relationships and rapports across the cycle of our projects, we are afforded multiple vantage points, meaning that we are not just ticking and sort of adopting a self-fulfilling prophecy of what a project should be. Again, stemming to the projects with young people, it means that young people directed where the project went, what kind of outputs the project yielded, how we publish. They chose to publish using events and arts-based methods versus PDF documents that's only accessed by researchers. And then active learning is well, a word that I tend to use, meaning that we try and go beyond dialogue, meaning we're not only interested in once of communication between 1 or 2 or more partners, we try to create avenues and pathways so that anyone can come into our space and continually work with us when we are working in a project. So that segues me into my 3rd, and I must say that although these are my top 3 tips, I have many other tips that I would have liked to have mentioned, but we like to maintain an active or anticipated flexibility and reflexivity in our work. So this simply means, and for lack of a better term, in all of our work, shit happens. Everything that we've designed at times can fall apart. We've all seen it with COVID-19 and what's happened to our projects and how we communicate. So maintaining sort of an active flexibility, we can design a project. However, we should account 4 different measures of correcting anything that may be misplaced. And this comes back to our first principle, which is shared value set. If we maintain that sort of true north, we can maintain enough flexibility to work around the current need within this space, working with people, as opposed to working and telling people what should happen. And then I think one of my final sort of points under remaining flexible is to be ready to learn with others, not necessarily always learning from others, because that also places us in a power position, which we feel rather uncomfortable with within a research space. And then finally, when it comes to reflexivity, we do have to pay cognizance to our own position within this conundrum. What do we do as researchers or as program designers or as connectors? What happens to that space once we enter it? Because we have to acknowledge our power. So at the very same time, we have to question ourselves, question the projects, and take guidance from these multiple vantage points. And we should say that looking at these 3 tips in the context of connectors, a lot of us have worked in various spaces where we have little power when it comes to larger institutions. And we don't want to assert that lack of power on others. So we rather choose to work with people like all of you, as well as people that are considered beneficiaries of programming. Rather, we want to see them as equal collaborators to the point of transparency around budget. So in conclusion, our tips for planning a new project is to establish your shared value system and principles as your guiding star or your North Star. Whenever you dwindle from that path, just look at your principles, and that allows you to make decisions based on those principles only. Investing in people and relationship building and establishing active rapport. So not just going in once off, but an active rapport with others will strengthen our projects and for mutual gain and greater impact. And then maintaining a sense of flexibility and reflexivity in your work, because, excuse my language, but shit happens. And we simply need to work with what we have. For now, those are my tips for establishing a new project, and I will hand over to Zandile.
Thank you, Nabil. Thank you very much. I see in the chat we seem to be really in unison around the top tips for working with multi interdisciplinary partners, and really different people from different walks of life, and also different people with different expertise. I definitely see that we are all in sync around that. All right, so I want us to actually move and see if do we have Kim on the line? Can I just check if we have Kim on the line?
Yes,
we do.
hi. Yeah.
Fantastic stuff. So I'm actually going to hand over to you now, and we would like to hear from your side in terms of the top 3 tips that you have for us for working with the multi-interdisciplinary partners. Thank you.
Hi. Sorry, can everybody see my screen?
I definitely can see your screen. Thank you, Kim.
Okay, so I do feel like I'm going to repeat a little bit of what people have said in the chat and what Nabila said, and also what I say might seem a little bit obvious, but we often forget the obvious, and that's why I felt it just bears repeating here. So my number 1 tip is about the brief, and I think we all know about how to put together a brief and the function of a brief, but the fact that we should write our best brief and then share it with our partners, so that the brief is co-created. But even once we've done that, then we need to make really, really sure that people are aware of the brief, that they understand it, and that they agree to it. I think I've been a connector for about 26 years, and I still make the mistake of writing a brief as clear as I can, and then emailing it off, and then just assuming that it's being received on the other end, that it's being read, and that it's being understood. And I'm often reminded that doesn't work. So like recently we did a project using with artists and scientists, and we wrote clear briefs and we sent them to the respective people, and we held meeting with scientists, meeting with the artists, and still after that we found that people weren't really some people weren't really understanding what was expected of them. And a lesson I learned from that as well is that also you should probably try and speak to people in their own language. So we should have maybe done a lot more visual stuff with the artists in terms of the brief, used video imagery, but I just can't overemphasize the importance of making sure that the brief is received, read, understood, agreed to. Then my number 2 tip is, like Nabil was saying, expect the unexpected. So risk, again, like a brief, risk management is a very, very important part of the preparation of any collaborative project. There's just so many things that can happen. You deal with people, and people get sick. They have emergencies come up. They simply forget that they're supposed to do something, and then you have things like pandemics, like COVID. So you kind of have to guess what might go wrong, and then put contingency plans in place for that, because it can just save so much stress, time, money, and your budgets. You can just really is useful to do a bit of risk management on any project, but especially collaborative projects where you're relying on so many different parties to come to the table. And then my final tip is the debrief. Again, I've been doing this a long time, but often as a project ends, the last day, which is the exhibition, or whatever the final step of the project is, you're often just so relieved, you just sort of want to walk away and forget about it until later when you have to write the report or whatever. But a very, very, very important part of the process is the debrief. Learning what worked and what didn't work, and then sharing it with all parties involved. For example, like with the project that we did to get with artists and scientists together, we did pre-surveys, we did post-surveys, we interviewed the different role players, and we also had beautiful artwork that sort of told a visual story of how much had been learned. We felt like the project was a huge success, and it was a pilot project, so we knew we would learn along the way, but sort of everybody that was involved sort of raved about it and said what a huge success it was. But there were so many things that we learned along the way, just by monitoring and evaluating. And so the next time we do this project, even though it felt successful and it was seen as quite a huge success, we know we can do it so much better just from the learning that we did along the way. And the fact that we recorded that learning and can share it with others makes it that much better. So that is my 3 top tips. And Nabil, I don't know if you have anything to add.
No, I just find it really interesting that our tips somewhat mimic each other, and I liked your final tip and what you said, which was, I just wrote it in the chat, but how the debrief and sort of closing of a project ultimately leads us into the evolution of our practice and the next steps, because I can see within your work and my work how it's evolved based on how we debriefed with our stakeholders. So I think that's great. Yeah.
All right, thank you. That's it from me.
Thank you very much, Kim. I truly appreciate that. That really resonated with me in terms of the brief and the debrief. It's so important because you tend to find that you're making the same mistakes if you have not debriefed, and especially checking in terms of what works, but also in terms of the strengths. Sometimes your partners, because of the unexpected, sort of develop sort of strengths from a particular project. So also just to be able to say, we've looked at a certain thing, or we've identified that you now have a specific strength that we would like to use should we do another project. So I would really like to thank our speakers in terms of the particular presentation. So Joy, Caroline, as well as Kim and Nabil. And I really want to open up this space. We have a few minutes before we hit break time, and I want to open up the space where, if you haven't spoken on the chat, or if you want to ask any of our speakers directly in terms of their experience, please, do come in and ask them directly. We do have a few minutes before we will be hitting our break. So you are welcome to unmute, you are welcome to open up your video and have any of our speakers answer any of your concerns or questions around their presentations. So I see.
Sorry.
Yes.
Sorry, no, I was just looking at Ellen Davies's.
Yes, I was about to read that too.
Yeah.
Fully in sync, Kim, fully in sync in this team, right?
Yeah.
really are. So I see Alun she says, in my experience, establishing long-term working relationship with government partners has been essential. Mine too, Alun, especially around public participation, particularly with the education and health sectors. These relations can be hard to sustain and manage. Do the presenters have any thoughts on how these relations can be strengthened?
I'm wondering, Zandile, if it would be possible. So she's not going to like me very much for this. So my co-director, Lindsay Reynolds, is in the room, and she may have better tips on this. Lindsay, would it be possible?
Sorry, I'm unmuting. I'm here. 1 second. Say that again, Nabil. My headphones just died, so I was in the middle of changing headphones, so I didn't even hear the question. I apologize.
So the
I was literally unplugging and replugging my headphones.
There's a question in the chat, in the last entry. I feel that given your work, you may be better able to address this.
How to establish government relations. I guess it depends on the size and scope of your project and whether you see government partners as a key stakeholder. I think it can be really challenging to do meaningfully, at least in our experience working here in South Africa. I often find that the kind of intermediary organizations are the closest you can get to government. So like a research council or that kind of collaboration. But having those direct pipelines to government partners is amazing if you could get them set up at the beginning. The one thing I will say from my experience is that it's really, really hard to do at the end of a project. So the most successful engagement we've had with government projects in a clinical trial kind of research project, we set up a research collective. We called it so it was a study called Pop Art, and we set up this thing called the Pop Art Research Collective up front at the very beginning of the trial. It was a 5-year trial, and we got high-level government officials who were working in the space. It was an HIV project, involved from the very beginning as like thinkers in the design of the whole trial and then the whole knowledge process all the way through. And I have to say that's the most successful experience I've had with working with government partners, because they saw themselves as knowledge producers, not just as stakeholders. So they were co-authors or collaborators on all the outputs that came out, and they really became like champions for the project in a way I haven't seen elsewhere, because they kind of felt like they co-owned it. So that I would say getting them involved and making them feel like they're part of the project. They're co-producers of the knowledge you're creating together.
All right, thanks, Lindsay. Good call, Nabil. Really good call. Thank you.
Can I also add something to that?
Please go ahead.
Yeah, as Lindsay had said, for us, as for the government to be co-owners of the project, it was easy for us to cooperate with the government, especially the national anti-FGM board because we all had the same agenda to make this practice to stop. So when we started the project, they also came in as partners because our agenda was to manage and to end this crisis called FGM. So we didn't actually had to kind of penetrate or find someone to introduce us to the government. They were already in and willing to be part of the project. So that is what has helped us to maintain the long-term relationship. Yeah.
Thank you, Caroline. Joy, did you have something to say? Did you have something to add? Oh, I apologize.
No, not quite. Thank you.
Okay. I apologize for putting you on the spot. All right. Okay, thank you. And just to check in terms of our panel, let me see. Oh, there we go. Our participants. How have the speakers made a case for or factor in the unexpected in funding bids for such interdisciplinary projects, or are donors, funders usually been understanding? So, there we've got Nabil.
Okay, I'm just trying to isolate a specific example.
Okay.
We worked actually the current project we're working on, I think, Sarah, you were part of this project, Planet Divak. The project was revolved around young people and their initial experiences of COVID-19, which ultimately was translated into a comic book between India, South Africa, and the UK. Initially, we never anticipated that the pandemic would last this long and how it would impact on our individual cities, never mind the globe. We then realized mid-project that the entire group in South Africa and other countries suffered from various trauma and mental health issues, and we never had the budget for that. So ultimately, we never had the budget for care. Yet what we did, I think, Sarah, you were part of this as well, we tried to minimize on existing expenditure. So we looked at our principles, coming back to that top tip, looked at our principles of self-care, whether it was written in the budget, because the project was written before South Africa got involved. So we had a minuscule budget. Ultimately, we looked at cutting down on certain expenses to make that work. I think at the time we contacted Lindsay as well, who was an existing Welcome grant, and her work was relative to care or self-care. So we looked at our internal, our sort of in-country partnerships, and we looked at our current expenditure and what we could do without. And that afforded us a space to bring young people to the care that they need, being professional care. So I think in those ways, it comes back to that flexibility and reflexivity, right? Like, what can we do, us being in this space, trying to, yes, drive the project, reach our goals, but at the same time, we have responsibility to the people we're working with. So I think in that case, it just took a little bit of sort of puzzle fixing and messing about, but looking, okay, what is our guiding principles? Self-care, we're working with people, they're not objects sort of research, they are collaborators. What do we do with our collaborators? We sort of treat them fairly as we would want to be treated. So I think in that way, I'm not sure if I'm answering your question directly. I'm just sort of stretching for a quick example. But in our work, we tend to always be moving our budgets around to account for the beneficiaries of these projects.
And just to follow up, Nabil, so how was that received by the donors and the funders? Were they understanding of you having to move some bits to be able to cater for that social care and how important it is? So maybe what did they want from you, in terms of why you now changing your initial plan, and why had you not included it in initially?
Well, we never included it initially because we were not involved in the initial sort of inception or design of the project. There was no table to come forward to. And this is not speaking negatively on anyone. The project was in existence and we were invited at a later stage. We maintained a sense of transparency with the donor and our partners. So some of our partners were working within the mental health space as researchers or practitioners in South Africa. So we reached out to them saying, hi, this is the current situation. This is what we can do. So we try to leverage what we currently have and then leverage our partnerships as well. And then also be very transparent with the funder. We're actively working on mental health right now. And this is what has come about as not a result of the project, but a result of sort of the global pandemic, right? So I think It comes back to that, the dialogue that we sought to establish from the very beginning with our stakeholders, including the funder. And the project was in the engagement space, so it was a public engagement award. It might be different within sort of a research grant. For us, it worked, just having that open communication with everyone within this conundrum. It worked. Not saying it might work in all spaces, but yeah.
Yeah, that's good to know that there was some sort of flexibility.
Can I also add something?
Yes.
I think with the research grant, there's always an incentive being added. Like we normally add a contingency or something like that, a 10 or 20% of the total cost for the unexpected occurrences. So when you write your proposal, I think you have to include a portion of that money that can cover the unexpected occurrences.
No, it makes absolute sense, Caroline. Definitely does. Yeah. We are just running a little bit over time, so thank you very much to our presenters, and also thank you for everyone online that is presenting the questions. Lele, I do see that you have a question. I'm going to ask our presenters to please answer her via the chat. I see Helen has already started. Thank you very much for that, Helen. Thank you for an engaging session. I really absorbed and learned a lot, especially around brief and debriefing, and also shared vision and having a shared sense of purpose when you are planning projects, and really trying to find out in terms of who has the ownership of the IP, in the initial stages of the program, in terms of really who are we delivering the projects for. So thank you very much for that. And I would love now to hand it over to Tash. So Tash, over to you.
Thank you, Zandi. And a very big thank you to all the speakers of the session. I think it's been a very meaningful one. So thanks to Nabil, Kim, Joy, and Caroline, and a big thank you to Zandi for holding space and being such an amazing facilitator. We're going to have a 10-minute break now, so that will take us to 2:30 or 12:30 or something else, depending on where you are in the world. Before we do that, I just wanted to introduce Dion. Dion is our resident visual illustrator who will be drawing some of the outcomes of the meeting so far and some of the issues that we've discussed. Dion will be doing this live, so he's a live visual illustrator, but he's also a user experience and user interaction designer, and has lots of experience in collaborative design. So during the break, some of his illustrations will be visible on the screen, and also at the end of the workshop. So thanks again to everyone, and thanks to everyone for participating in the discussion, and we'll see you back at 2:30 or 2:12 in 10 minutes. Thanks. Please do come back.